All right. Hey, everybody. I am Stephanie Fish, your training program coordinator for the KDF Mini and Marathon Norton Sports Health Training Program. Welcome to today's Tuesday talk. We put together a lot of different topics to talk about on Tuesdays throughout our training. And this one is just a little pop-up with our friends from KORT Physical Therapy. So before we get started, I just wanted to cover a few housekeeping items. No one is on camera and everyone is muted except for those of us speaking. So no worries on how you look or what you're doing or where you are today. We can't hear or see you. And with this topic today, I definitely wanted to point that out because it might be a little sensitive topic and there might be some sensitive questions that you would want to ask. We're all anonymous here. It's cool. Go ahead and just throw your questions in that Q&A on the bottom of your Zoom screen at any time during our program. This video will be recorded, as I mentioned, and it will be posted in the KDF Training Facebook group. So you can always rewatch it later or maybe watch it for the first time if you weren't able to join us today. So let's kick off our topic for today. Again, our friends at KORT Physical Therapy wanted to discuss pelvic health therapy or pelvic health basically for females and specifically for females runners. So joining us today is Teresa Smith and Jackie Neugornet from KORT Physical Therapy. They are pelvic health therapists, so they should be able to help us with some of our questions and thoughts and issues that we might have as female athletes. So thank you both for joining us. You're welcome to unmute yourself and chime in. We're super casual here on our Tuesday talk, so we all just kind of go along and just say whatever we're thinking here. So welcome.
Thank you. Glad to be here.
So I know I've seen both of you at a couple of my training runs, at least one I know for sure. I think you both came out to the coldest training run.
I think so.
That was a really good one to come to. I think the sun was shining, but yeah. So you guys are aware, you know, you're runners, you understand some of the issues that some of our female runners might have. And I'm very happy that you're here and we're talking about this topic. As you mentioned, you know, it's kind of taboo or, you know, nobody wants to talk about it, but it's things that we should talk about. So I know you have a little presentation for us today. If you'd like to pop that on there, I'm going to hide myself and let you guys do your thing.
Okay. Awesome. Yeah. So we're just going to talk about some pelvic floor issues for runners today. So. All right, so do you leak urine or stool when you run? Do you pee more than once before you run? And then do you stop to pee during your run? Do you have to have a rigid set routine to control your bladder or bowels during a run? Have you recently had a baby? Or do you have hip, groin, or low back pain? If you answered yes to any of these questions, I think this is a good topic for you to hear about. So we're going to talk about the pelvic floor. Everybody has one, just happens to be that the picture shows the uterus instead of the prostate, but it's basically just a hammock of muscles that helps to support those organs and to squeeze around the openings to allow urine and stool to stay inside until you are ready to evacuate them. They are essential for sexual function for both male and females. And then also they're part of the core. I think a lot of people think about the core as just your tummy muscles, but really that helps to support from below. And then the stomach muscles, the back muscles, the diaphragm, it all kind of comes together to create your core. And it's sometimes the hammock can fail, right? So those muscles, if they get weak or if they're they might loosen or drop. And so we're going to talk about kind of what happens when that hammock fails. So I think most people think about incontinence, so losing stool or urine. it's actually can occur in a lot of different ways. So you can have urgency of stool or urination, frequency. So going more often than 7 times a day is considered frequent. You can have pelvic pain or groin pain or bladder pain, like interstitial cystitis, hip pain, low back pain, pain with sex, slow flow or hesitancy of urination, incomplete bladder emptying. A lot of times that's why you have to go more than once before your runs, because you're not fully emptying your bladder. It can look like abdominal pain or constipation, even diarrhea or incomplete bowel emptying, having to go more than once. And then also pelvic organ prolapse, which is that drop of the pelvic floor muscles. So I think any Google search will tell you that if you have pelvic floor dysfunction, you need to do Kegels, whichever one you want to call it. And I think a lot of times that's correct, but sometimes it's not. And I would say that, at least half, some references say over half of people do it incorrectly. So that might be that they're using the wrong muscles and they're not doing it correctly from a literal stance, but also they may not actually need to do Kegels or Kegels. So we're going to talk a little bit about kind of some of the myths surrounding the Kegel exercise. So.
All right, welcome to Mythbusters, Kegel edition. So myth 1, I should practice Kegels while stopping the flow of urine. Incorrect. So if you've done this once or twice, that's not the end of the world. It's not a bad thing to check and see, can I do it? But practicing your Kegels while you're trying to empty your bladder can have negative consequences like increased risk of UTI. All right, I should just do a few squeezes whenever I think about it. So a lot of times we're told every time you stop at a stoplight, do a few Kegels. So that is a myth. If you are not intentional about it, you might not see the gains that you're looking for. So if you were, for example, going to the gym trying to get stronger, well, you wouldn't do a squat here and there throughout the day. You would set a certain number of repetitions and a goal of trying to hit. So we want to be intentional to be effective with those Kegels. All right, I should squeeze everything as hard as I can. So that's a myth. When you're trying to do a Kegel, nothing else should be moving. So you want to make sure that you're not squeezing the muscles in the back of the hips, the thighs, the stomach. You want to avoid holding your breath while you're doing the exercise. So when you're doing a Kegel, you want to think about breathing out and squeezing and pulling in just those pelvic muscles. We'll talk a little bit more about that in a minute. So how do you do a Kegel? When you're starting out, only do the number of Kegels that are fairly easy for you to do. So let's all try it together. So get in a nice relaxed position. You'll want to think about squeezing around those openings and lifting. So if you're sitting with us, think about you're going to squeeze and lift off the chair. Okay. You might even place your hand underneath. Make sure that those other muscles are relaxed. Okay. And then as you squeeze and pull in, try to hold 3 seconds, 2, 3. And then if that's a fairly easy number, you might try 5 to 10 times and do it twice a day and work your way up from there gradually to where you're doing 30 to 80 times a day. All right, so sometimes you just have to let it go. So if you've been doing Kegels and you're not getting where you need to be, it may not necessarily be that your muscles are not strong enough and you need to do more Kegels. Sometimes those muscles can be too tight. Okay, muscles work best in their middle range. So if it's too tightened down, we can't necessarily get the good squeeze that we need from them. So instead, you might try a few relaxing positions first. So first one's called diaphragmatic breathing. That's deep belly breathing. So if you put one hand on your chest and one hand on your stomach, take a deep breath in through your nose. And you want to try to see if that hand on the stomach will lift more than the hand on the chest. So really getting a good diaphragm contraction with that. So when you do that deep belly breathing, that tells our pelvic floor to relax. And then pictured on the right is a pose called happy baby. That's a pelvic muscle stretch. So laying on your back, trying to grab the toes, ankles, or even the knees if that's more comfortable, and drawing those knees in towards the outsides of the rib cage. Okay. If your car is leaking oil, you take it to the mechanic. If you are leaking urine during exercise, you need to see a specialist. So we have several locations throughout Louisville and Southern Indiana. So please, if you've tried these and you're not where you want to be, reach out to one of us. May your coffee, pelvic floor, intuition, and self-appreciation be strong. Thank you. Any questions?
Thank you very much for that. Yeah, if there are questions, please, we want to use the Q&A feature on the bottom of the screen. I have a couple of questions that I picked up during your presentation. So you mentioned the Kegels, but I've also heard another good exercise for that are glute bridges.
Yeah, so I think that is good. However, you have to start with making sure that you can isolate the pelvic floor muscles. So typically that's an exercise I add in with the pelvic floor contraction. So a lot of times people do a bridge and they're kind of squeezing everything at once. But you need to, I think it's more effective if you can isolate it first and really feel like you're getting a good squeeze and lift with the pelvic floor, and then add in the glutes, because you're right, they don't act in isolation. I mean, they work with the glutes, they work with other muscle groups. So I think that's a good advancement of those exercises.
Got it. And then you mentioned the pee 7 times a day thing. So you're saying realistically, on average, you should only have to use the restroom 7 times a day?
That's correct. So about 2 to 4 hours in between every time.
Okay. I know people that go 7 times at night. So referring to that, what about nighttime? You know, constantly getting up to urinate. I would like to address that because I know a lot of people have problems with getting through the whole night without having to get up.
Yeah, so that is something we can address. Normal would, expected would be once, getting up once, maybe twice at night. So some easy things that, if you're going frequently throughout the day and you're waking up often at night, maybe needing some bladder retraining to address the bladder's capacity to hold. Easy things to try as well is making sure that you're getting more of your hydration through the day and then cutting fluids back in those last couple hours before night.
Okay. And then I have one more. Hey guys, there's a Q&A section there. I don't have to be the one asking all these questions. Come on, let's go. And then just thinking about some of our moms. So how long after baby would you expect it to take to kind of get back to, if at all, get back to quote unquote normal, where maybe you're not having those issues, or is there anything special that maybe new mom should be doing or thinking of, or just kind of addressing that?
Yeah, I think that's a great question. And I think there's a ton of variation. I think it depends on if you were running during your pregnancy, I think it depends on, how much you were running too. I think it depends on your delivery. If you had a vaginal delivery where you had some tearing versus a C-section versus, a pretty uncomplicated delivery, your recovery is going to look a little different. And I think, a lot of times, you go to the OB at 6 weeks and they're, saying, okay, just go back to your normal activities. Well, your body may not have recovered. I mean, it may have literally, the tissue may have healed, but the rest of your body is not recovered. And so I think that's a hard question, I think, to answer, because sometimes people still have core weakness and, abdominal weakness, or, frequently in postpartum runner moms, hip, outer hip weakness, hamstring flexibility issues. I mean, that's a little bit more common. And so, I would say if you are at the point where you are able to walk for 30 minutes most days of the week, and you're not having any leakage, then, you could probably start a running program again. But I would really urge any new mom to be evaluated by physical therapy to make sure that we address those things early, so that they're not in, 2 years or 3 years or 30 years later still having incontinence, So sometimes even if you don't have incontinence, I think it's really good to just go get a checkup from a physical therapist, because your OB is really not looking at your muscles and the readiness to return to activities. They're looking at your uterus, So I think it's a good thing to look at the person as a whole.
Yeah.
That was long-winded, sorry.
No, I think that was great. Your OB/GYN, obviously they know their stuff, but they might not necessarily be looking at those muscles around the uterus that they're focused on. So yeah, good point on that. We do have a question. So another hydration question as related to the number of times going to the bathroom. It seems the average is higher if you're drinking more. So is that to be expected, or how long does it take so if you're drinking a lot, how long would it take your bladder to get used to maybe holding that large amount of water you're drinking through the day and not have to go as frequently? So for instance, let's say I drink this cup of water and within 30 minutes I got to go, and then I got to go again 30 minutes later, and then I keep drinking more water, and then I got to go 30 minutes. Like, is there a way, I guess they're asking if there's a way to kind of train your bladder to get used to holding that liquid?
There is. Yes. So normal fluid intake, it's about half your weight in ounces per day is what we expect. So when you're trying to train your bladder to hold more, if you find that you're not able to, being able first, are you having any urgency issues, like where you're running to the bathroom? First, getting that ability to quiet the urge and wait a few minutes. So things that can be helpful for that, when you feel that urge, doing just a few quick Kegels, taking a breath and keeping your body calm and your face calm in that response is helpful for that. And then basically you can gradually, when you have that urge, if you can wait a few more minutes, sometimes your bladder is giving you that urge when it's not completely full. And so if you find that you're going and you're not emptying very much, but you felt like you had to go, that bladder may be giving you that urge to go when it's only about halfway full. So first thing is getting that urge under control to where you can pause for a few minutes and say, do I really need to go? Or can this wait? And we've all had that experience where maybe you had to go, but you were in the middle of doing something and you had to push it to the back of your mind, and that urge went away. And then later it came up again and you realized, oh, it's been a certain amount of time. And I did have to go a while ago. So making sure that you're not doing those voids when you don't really have to go quite yet, where the bladder's not full. And gradually increasing that amount of time in between. So waiting a few minutes before you do go, and avoiding going just in case. So, you know, if you're about to go on a very long car ride, and you empty your bladder before you go, not a huge deal. But if you're going just in case every time before you get to work, and then when you get to work, you have to go, again, just in case, because you've got a patient coming in and you don't have to go in the middle, that frequently emptying before you really are full can lead to where your bladder is sending that signal that you need to go before it's really completely full.
I mean, I do the just in case pee all the time. And if we were to refer to like before a race, so I mean, all of us, just in case, I gotta go just in case before we start. And then you're standing there at the start line for 20 minutes before starting, you're like, I think I gotta go. I think I go, but you don't have to go. You're just anxious. So, you know, and once you start running, it goes completely away. So, and then also just talking about those, well, before we move on, we do have a question. I have a question about, actually I have two questions, so we're going to keep moving on. But Jeannie says, I've heard you should void for at least 9 seconds. And if you don't, then you should have waited. Is that a true statement? Anybody?
I mean, I don't think there's any truth to that hard number. I mean,
yeah,
you know, yes, you should be able to go to the bathroom and fully empty your bladder. And so if you're going just in case and you're going, you know, for 2 seconds, but you really felt like you had to, I would really look at, okay, how often am I going? Maybe I didn't really need to go. Or, you know, something else we haven't talked about are bladder irritants. So if you have soda, coffee, tea, you know, things like that, that's going to irritate your bladder. That's going to cause that bladder to contract and give you that signal that you have to go more frequently. So that's a lot of times where we'll start with people who have that urgency or frequency, is we'll just have them write down what they're drinking. And I've had people come back and say, gosh, I cannot believe how much soda I was drinking. And they cut it back and they were, you know, 50% better just with reducing the bladder irritants that they were having in their diet. So that can make a huge difference too.
And going back to the urges or the just in cases, specifically referring to a running race, you know, visiting the Porta Johns during the race. I know a lot of people just feel that urge that they need to, and it might be, you know, like you mentioned, it might be your bladder isn't quite trained to withhold the water that you're drinking throughout the race, even though your body's actually absorbing that water for exercise. So is that more of like a mental over physical thing there, or what is it?
Well, that depends on if it's happening, I would say outside of the race, right? If there's some frequency and urgency issues all the time, or if it's just during, that could be the bladder getting the signal all the time. That more, like you said, mental component. It could also be a tension component, the muscle tension.
Or the leaking. I mean, if you're leaking while you're running, like you said, you don't have the muscle ability to hold it in,
and they're fatiguing.
You feel the leak. Yeah, you feel the leaking, and then you're like, oh well, I better go to this Porta John real quick because I think I might be leaking. So totally out there. I mean, everyone has the issues, I'm sure. And then one more thing. So we were talking about emptying the bladder. I was always taught when you go to the bathroom, you know, everyone's in a hurry all the time. So we go pee as fast as we can. We do everything as fast as we can. So I was always told, go to the restroom, and when you're done peeing, continue to sit there for a few more seconds, because you want to try to completely void your bladder every time, because then that will help with the future urgencies of feeling like you still need to go. Correct, or advice?
Yeah, no, I think that's a good way to make sure that you're emptied. You know, for women with prolapse, where their bladder might be dropping, or their uterus or the rectum might have dropped a little bit, there might be some kind of pockets within their pelvis where the urine can get sort of trapped. So for some people, to make sure that they empty, they need to actually stand up and then sit back down, and they might actually have some more urine. Or, you know, sometimes wiggling kind of on the toilet can really help to make sure that all of that urine comes out. But I think that's a good habit, to just kind of make sure that we are completely relaxed so that those muscles can empty all the way.
Yeah, and it's just, like I said, people are always in a hurry. So, so great information, ladies. I appreciate all of this. We are going to post this video in the Facebook group. So if there's any further questions, you can always comment on this post with more questions, and we'll try to get those answered as well. I'm going to pop up my screen real quick just to touch base on our next Tuesday talks. So we do have 3 more Tuesday talks left in this training season. March 29th, we're going to talk about our long run, our upcoming long run, which is fast approaching, and then rest and tapering tips after that long run. So how to continue to get you to race day without the anxiety and the fidgety that you're going to feel after you do that 20-mile run or that 12-mile run, which will then lead into our mental performance for athletes. We're going to try to calm your fears and your anxieties before race day with expect the expected. Last year, we talked about expect the unexpected, and this year it's going to be expect the expected. So we're going to talk about that with mental performance director, Dr. Vanessa Shannon. And then the week of the race, we are actually chatting with the race director himself from the KDF Mini and Marathon about all of your last minute questions for race day. So some really great Tuesday talks coming up. Ladies, I really appreciate today's Tuesday talk. Again, it will be posted in the Facebook group, and we can ask some further questions within that group as well. So it is Tuesday, guys. We do have a training run tonight at Cherokee Park at Hogan's Fountain, doing some hill repeats. So we're going to work our strength tonight as a group, and it's at 6 o'clock. The weather should clear up, and we're going to have a great night. So I hope to see you all tonight at Cherokee, and if not, then maybe this coming Saturday group run, which will be at Swags South. And I will see you there. Thank you all for joining us. Appreciate it.
Thank you.